Thank you, Cathaoirleach. And look, I don't expect the Oireachtas to be able to come back today with a response, but I would appreciate if, after I raise these questions today, that someone would come back with a detailed response to me, rather than commitments being given here in the House that we'll get replies and then nothing is forthcoming. I have three specific issues that I want to raise. Two of which are in relation to bureaucracy, sadly. And the first one is that patients that are undergoing hospital procedures must have a clear COVID test in advance of going into hospital, which is completely understandable. But in some instances, the hospital are not accepting the negative PCR test result coming from the HSE community testing. Instead, patients are being asked to make a preliminary journey into the acute hospital for a pre-COVID test, which is exposing those hospitals to additional and unnecessary risk in relation to COVID infection. Now, I've already raised this with some hospital managers, and the justification for it is that the computer systems are not talking to each other. So because the test that's carried out in the community by the HSE, that is not accessible by the hospital is insisting on its own separate test being carried out, and they won't accept the text message that comes back from the HSE. Now, this is a procedural, bureaucratic issue here that's putting additional hardship on patients in advance of going in for a hospital procedure and exposing our acute hospitals to unnecessary and additional risk of COVID infection. And I want to see this issue addressed. Now, speaking of the issue of bureaucracy, on the 21st of April here, the Minister for Health, in a parliamentary reply 2083, stated that the following list of vaccines where people are fully vaccinated don't have an exemption from mandatory hotel quarantine. Included in that list is the AstraZeneca vaccine that 15 days after your second dose, if you have that in advance of coming into this country, you're exempt from mandatory hotel quarantine. But nowhere in this parliamentary reply does it make reference to where the vaccine is actually manufactured. And it's only when you get into the detail of it. And the Department of Foreign Affairs has informed an Irish citizen that there are 4 versions of EMA-approved vaccines that are manufactured under licence by other companies that do not qualify for exemption in relation to the mandatory quarantine. So we're saying that these vaccines are good enough to be used here in this country to vaccinate people. However, versions that are manufactured in other manufacturing facilities will not be accepted in relation to mandatory quarantine. And for example, the manufacture of the AstraZeneca vaccine in the Serum Institute will not be accepted as being exempted for mandatory quarantine, even though that person is fully vaccinated in terms of COVID-19, but because of the location of the manufacture of the vaccine, it's not being accepted. Now, that needs to be changed in relation to mandatory quarantine. The third issue that I want to raise is that a constituent of mine last Friday night, who was in mandatory quarantine, was in unbearable pain. They contacted reception in the quarantine facility seeking medical help. A nurse called to their room and the nurse told them that they couldn't issue them with any medicine whatsoever, including paracetamol, but that a nurse would call the following morning in order to facilitate them ordering pain relief. Eventually, after contacting the reception again on Saturday morning, the medicine was ordered at 2 o'clock last Saturday. And only after further calls to reception and seeking the assistance of a doctor, the medicine arrived at 9:40 p.m. last Saturday night, 24 hours after being in unbearable pain. No doctor ever arrived, no vital signs were ever checked, but they were told that the nurse would be back later on that night to check their vital signs. 110 hours since that commitment was given, no doctor has arrived and no vital signs have been checked. Now, my question is, what medical service is available to people that are being quarantined? My constituent is after coming from quarantine in New Zealand, where they were checked every single day by nursing staff. Their temperatures were checked every single day, and yet they can't even access paracetamol here. They can't actually get access to a doctor here, and their vital signs are not even being checked here. There's something wrong with that system. The final point that I would like brought to the attention of the government is the trauma report that was approved this week by Cabinet, designating the Mater Hospital as the major trauma centre in this country, which I very much welcome. However, the fundamental issue is, how do we get patients into these trauma centres in the Mater Hospital or in Cork? Because we haven't been putting the investment into our ambulance service. And as you know, Minister Butler, you've already said that 10 ambulances up to this week are being involved in the vaccination of the housebound. That has been doubled to 20. So we have 20 ambulances taken off our road. We don't have an effective air ambulance service. We're centralising the trauma services, and we're not figuring out how we're going to get very ill patients into those hospitals. Thank you.
Deputy Niamh Smith. No, you'll have time at the end, Minister, but Deputy Naughten used his
Unfortunately, the deputies are asking an awful lot of questions and not allowing any time to respond.
I get that. You have time.
Unfortunately, the Senior Minister isn't here.
Could I just make on a point of order, and I think if the deputy would...
Minister,
sorry, Ceann please. Dáil statements on impact of COVID-19 on mental health and older people. Yeah. That's what's on today.
No, what has been agreed by the Business Committee, that all issues relevant to COVID-19 can be raised here, and the Ceann can clarify that for the House.